Hello, my name is Marissa Lombardo. Today, I will be discussing the Bismarck healthcare model and how it is utilized in Germany. First, let me clarify what the Bismarck model is. The Bismarck model was born in Germany and named after Otto von Bismarck, the man who invented the welfare state as part of the unification of Germany in the 1800s. In this multi-payer system model, the insurance system is financed jointly by employers and employees through payroll taxes called sickness funds. These taxes are directly deducted from paychecks. The system is somewhat similar to our American healthcare system. Most Americans who are employed but not yet eligible for Medicare receive health insurance coverage from their employers as a benefit of employment. However, the employers limit the list of health insurers their employees may use. In Germany, employees have about 240 types of sickness funds to pay into and choose from. The Bismarck model was designed for every citizen to be covered and does not make any profit. Therefore, many countries, including Germany, using the Bismarck model house private hospitals and physicians. There are countries other than Germany using this Bismarck model as an outline for a healthcare system in their country. Other countries using this model include France, Japan, Belgium, the Netherlands, Switzerland, and to a certain extent, Latin America. One of the differences in Germany's public health compared to other countries is that they have multiple competing insurers. This means that the citizens of Germany may choose from a different array of competing insurance companies to cover their health care. There are about 240 different ones that can be chosen from, like I mentioned earlier. In France, they have a single insurer, so there is no choice to be given on which insurance company to choose from. In Japan, there are multiple non-competing insurers. Japan has multiple districts or regions to it. Each region has its own insurer, so there are multiple insurers in all of Japan. However, they don't compete with each other because they are only able to work within their own district. However, no matter the number of insurers in the country, one similarity is that the government tightly controls the prices of healthcare while the actual insurers do not make any profit. To learn further on the healthcare in Germany, please watch the video on the following slide. Please pause the video here and watch the YouTube video provided and then come back to this presentation after this 7-minute video. There are multiple concerns that come up with the usage of this model. For example, the focus on low costs and efficient care means that there are less healthcare services available for citizens living in rural areas. Also, mandatory employment taxes are high in order to keep healthcare affordable. Along with that, there are longer waiting times for patients to receive elective, secondary, and tertiary services. One of the biggest problems with the Bismarck model is figuring out how to care for citizens who are unable to work or to afford contributions. How is their health care paid for, and how will they be covered? The model is meant to cover every citizen in Germany, but it is based off of employment. So, if someone does not have the ability to uphold a job for a serious and valid reason, how will they be able to be covered? Some more minor issues with the model question how to contend with aging populations or with uneven number of retired citizens compared to working ones. The model also makes it more difficult for Germany and other countries to stay competitive in attracting international companies who may prefer locations without these payroll dedications. Although there are multiple countries other than Germany that use the Bismarck model, the health of the people in each country varies when comparing country to country. All of the countries using the Bismarck model mentioned earlier, Germany, Switzerland, France, Japan, and so on, all have a similar life expectancy. Each country averages in the low 80s, which is a fairly large life expectancy and allows for many long and happy lives. Japan, however, has a lower rate of child deaths under the age of 5, where Germany, France, and Switzerland all have a similar rate that is much higher than Japan's. Out of 1,000, 2 children under the age of 5 die in Japan each year, compared to the 4 in the other 3 countries. All these countries have a higher rate of passing between the ages of 15 and 60. This could be due to disease, accidents, etc. However, smoking is a very popular activity in Europe, especially France. France also has the highest death rate out of the 4 countries from ages 15 to 60, although the rest are not far behind. Other health habits like the food consumed, the amount of exercise people get, and how they control illnesses in the countries all play parts in one singular country's public health. For example, Japan has an obesity rate of about 4% compared to France's staggering 21%. This could be due to food, exercise, any other health issues that come about. Because the culture of each country is different, the public health will be slightly different and will be affected even though they may be using the same model of healthcare. Like any other country, Germany is very diverse and made up of many different cultures, ethnicities, and religions. This means that many different types of people use the German healthcare system, and that not everyone will have the same idea of what healthcare should be or what it should do. For example, people will have differences in opinion of how care should be given or what types of treatment should be utilized. Although Germany is made up of mostly Germans, there are other cultures within that can attest to having different perspectives on healthcare. The ethnic makeup in Germany is mostly European: Turkish, Greek, Russian, Italian, and Polish, and there is also some Spanish descent. Although these are all mostly of European descent, they each have their own individual culture and belief system, and they may not align with that of Germans. An example would be that Russians become very uncomfortable with having open conversations about personal information and their health, whereas it does not bother people of other cultures. The diversity in the country also brings up the question of communication and use of different languages. About 95% of German citizens speak German as their first language. However, Danish, Kurdish, Serbian, and Turkish are also popular languages. This excludes any vacationers or new citizens that are seeking healthcare and speak languages other than the ones listed earlier. This could allow for patients in need of healthcare speaking a language other than German to have difficulties understanding or receiving care. Another large part of cultural diversity is religion. Christianity, Muslim, and Catholic are the 3 most common religions in Germany. What this means for healthcare is that patients of different religions may have different ideas of how they should be treated or how far they want to go with treatment, and so on. One person may not agree with or consent to the course of treatment due to their belief system. Germans also value perfectionism, making it hard for them to admit to their faults. In healthcare, this could mean that if a professional were to make a mistake, they may have trouble owning up to it, and someone who is not of German descent may not understand why and have a bad experience receiving their care. Respecting cultural diversity includes respecting all citizens and familiarizing yourself with certain aspects of multiple cultures. In order to receive diversity in healthcare, there are many things that can be done. For example, respecting one's personal space will show respect. Some cultures are very close and have a small amount of personal space. They may give hugs as a form of thanks or as a welcoming, and other cultures may have little personal space and see it as disrespectful to be so close and touchy. As a healthcare professional, having the ability to respect either circumstance is very important to make the patient feel as comfortable and welcomed as possible. Religion is another large part of healthcare that always needs to be respected. If someone doesn't agree with a course of treatment because it goes against their religious beliefs, it is important to be respectful of that and understanding and find another way to go about helping the patient that aligns more with their beliefs. With cultural diversity comes different languages, so having translators or the ability to speak multiple languages is always helpful with communication and helping the patient understand what is going on with them in a kind and caring way, and not having to try and translate or make them understand in a confusing, disrespectful manner. Respecting the patient's time is also very important in order to give out successful healthcare. Some cultures believe in arriving early, and others see that as disrespectful. Always being timely shows respect to the patients and shows that you care about their time and the places that they need to be. No patient should ever be treated differently for where they stand on any of these circumstances. That is why it is so important for healthcare professionals to be respectful and give out the same quality of care to every patient that comes in, even if that means going the extra mile to make them feel more comfortable and have a better understanding of what is going on in order to have a good experience in the German healthcare system. Thank you so much for listening and have a nice day.